Few words about the management of depression and anxiety. The incidence of depression and anxiety is approximately 3 to 6%. And if somebody is diagnosed with depression and anxiety, it's just like you are diagnosed with diabetes, high blood pressure, high cholesterol, hyperlipidemia, ischemic heart disease. So just like that. So there are different ways to manage. The most common and my favorite one, if it works, and it works in most of the patients, is cognitive behavior therapy. And I always tell to my patients is cognitive behavior therapy is not only therapy. Take it like you are taking a medication and it works. You just need to find out a good therapist. A therapist who can sit down, who can evaluate, who can do the assessment and make a plan. So cognitive behavior therapy is very, very helpful. There are many medications which are approved by FDA, and a good experienced physician can prescribe those medications for you. And these medications work, and they are really very helpful. You just need to find out a good physician who can diagnose and suggest the best medication which is good based on his evaluation and your medical comorbidities. There is another way of treating and managing depression and anxiety is called neuromodulation, like ECT, electroconvulsive therapy, TMS. There's another treatment called ketamine infusion, and there are some new treatments available. So the best thing is, if your physician says that I think you are suffering or you are having symptoms or your symptoms are concerning for depression and anxiety, so best thing is go and do the evaluation. And if you have, then get a better treatment. Get the treatment. That is very, very important because it can change that whole life. It can improve your quality of life and you will feel the difference. And sometimes it's difficult to explain before the treatment, but you can ask those patients who were diagnosed, they got the treatment and then they notice the improvement. So I will strongly recommend, if your physician says that I think some symptoms are concerning for depression and anxiety, please go get help. And as I always say, asking for help doesn't make you weak. Only strong people ask for help. And remember, there are people around you who are always ready to help.